I'm Dr. Sivaraman Shoulder consultant from Chennai. Now we see what the post-operative we will do for both the Bankart and the cuff repair, Bankart repair and the cuff repair. First 2 weeks we will do the passive exercises mainly, and Mr. Murali is going to show what the exercise we are going to do for the shoulder now. First we will do the elevation of the shoulder blade and retraction of the shoulder blade. You need to do this exercise with a sling on. Then we can remove the sling and then do the pendulum exercises, which you need to stand. You can either support with a bench or a stool and then hold the hand just to bend forward and then do the clockwise and anti-clockwise. In each 10 times you can do that. The front and back and on the sides as well. And now we'll do the passive external rotation, which hold the hand with the other hand and then do the external rotation. And we do the passive flexion next. We'll do it by lying down position, which hold the hand with the opposite hand, and then you can just lift it. Keep the hand straight and then lift it. You can come up to 90 to 120 degrees of flexion. It's better to do it in lying down position, therefore you won't feel much pain and you'll feel some comfortness with it. Okay, you can repeat this one up to 10 times morning and 10 times in the evening. Okay. Now we will see what we do for the 3rd and 4th week after the surgery. We will do the passive external rotation. You hold the arm and then external rotate it to the 30 degrees from neutral position. That's up to that position. You need to hold the arm and do this one. That's the passive external rotation. Repeat it to 10 times. And then hold the arm with the other hand for the flexion. Keep the elbow straight and then lift the arm up to, you can go up to 150 degrees. You can do it by holding with the other hand, therefore it does a passive movements. You can do this exercise, repeat it up to 10 times. Do this as pain allows. Thank you. We will do the 5th and 6th week after the surgery. The exercises will do a passive flexion up to 150 degrees as we did before, and passive external rotation to be increased up to 45 degrees here, which will hold the arm and then external rotation up to 45 degrees here. You can get the help from others as well. See whether you can get up to the 45 degrees up to here. We did it up to 30 degrees before to here. We increase up to another 15 degrees extra here. As pain allows, do it slowly. Okay. And then you can do a passive abduction, which you will hold the arm, support it on the scapula here, the back of the shoulder, and then lift the arm up to 30 degrees and then go up to 60 degrees here. Consult with your doctor, make sure he is happy with it to go to 60 degrees. You not do anything actively. The person lifting it, the patient not supposed to do anything. The other person is doing it, lifting them. You need to lift the hand. Okay, thank you. Now after 6 weeks after the surgery, no sling is necessary. We'll take the sling out and start the wax bath with physiotherapy for 7 days and start all the active movements. The movements will show you what are the movements here, like a flexion, forward flexion, full flexion. This goes up to that. And then you can do whatever the level you achieve, you can do it. And then forward flexion in scapular blade position and abduction in the plane in the side. And you can do the active external rotation and internal rotation and reach to the opposite shoulder. Okay, these exercises you can do it, and then the internal rotation as well on the side here. These exercises you can do it actively after 6 weeks. After 7th week onwards, you do all the strengthening exercises, which will show in the other video.